We'll go ahead and get started. Good afternoon, everyone. Welcome to the first webinar of our three-part webinar series hosted by the National Center on Substance Abuse and Child Welfare. Big thank you to everyone for being here today, taking the time out as we walk you through an introduction to the National Center, our technical assistance supports, and if we have some time, we'll look at some of our resources that can support your work in improving child and family outcomes. The National Center on Substance Abuse and Child Welfare is a collaboration at the federal level between the Administration for Children and Families and Substance Abuse and Mental Health Services Administration, and provides information, consultation, training, and technical assistance to child welfare, SUD treatment, court personnel, and other systems serving families. And we're going to go a lot more deeper into that with you today. And with that covered, I will now pass this over to Amy V. Smith, ACOR for the National Center on Substance Abuse and Child Welfare. And I'll now turn it over to her to kick us off. Thanks, everyone.
Thank you so much, and welcome everyone to this very important webinar that I'm sure will be very informative to all of you and those who you work very closely with. Right now, I want to share with you some information about SAMHSA. I will talk briefly about our mission and our strategic plan. The 2023 to 2026 SAMHSA strategic plan presents a new person-centered mission and vision, highlighting key guiding principles and presenting new priorities, goals, and objectives. To achieve its mission, SAMHSA has identified 5 priority areas to better meet the behavioral health needs of individuals, communities, and service providers. Next slide. The 5 priority areas are preventing substance use and overdose, enhancing access to suicide prevention and mental health services, promoting resilience and emotional health for children, youth, and families, integrating behavioral and physical health care, strengthening the behavioral health workforce. SAMHSA's work is guided by 4 principles that are being integrated throughout the agency's activities. The 4 core principles are equity, trauma-informed approaches, recovery, and commitment to data and evidence. Go to samhsa.gov and download the Strategic Plan 2023 through 2026 to read in detail how the 4 principles are interwoven in the 5 priority areas. Next slide. Right now, I have the honor and pleasure of introducing Dr. Nancy Young, Project Director of the National Center on Substance Abuse and Child Welfare, which is conducted through the Center for Children and Family Futures. Dr. Young?
Thank you so much, Amy, and thank you for this opportunity as well as your ongoing leadership for the PPW grantees, as well as the work that you do for the National Center on Substance Abuse and Child Welfare. I'm going to talk about the overview of Children and Family Futures on the next, the next slide. And these are the major technical assistance and evaluation projects that we have going on. You see our mission on the left, as well as the various programs that we operate. We're in our 22nd year operating the National Center on Substance Abuse and Child Welfare. And you see the addition recently of the pregnant and postpartum women grants to the National Center Technical Assistance portfolio. So we're delighted to be able to work with you, but wanted to make sure that you also know about the other technical assistance programs in case you're affiliated with a family treatment court. We work with the Office of Juvenile Justice and Delinquency Prevention on providing the technical assistance for family treatment courts. We're the national home for the sobriety treatment and recovery teams, training and technical assistance program, that's START. And START is one of the evidence-based programs that's on the Children's Bureau's evidence-based programs through the Family First Prevention Services Act, and then a variety of other technical assistance and evaluation projects. We look at this overview at the next slide of how we conduct technical assistance and what sort of drives our mission, recognizing that we, as well as grantee sites and other jurisdictions that we interact with, to provide TA, that there's a evolution, if you will, within grants. There's a life cycle of understanding your partners, understanding within your own grant program, the developing that knowledge, really looking at what does that mean to advance practice and advance policy with your colleagues in the community. How do you sustain that effort over time? And how do you get to systems change so that those improved practices remain after the grant program? We do that through those items that are on the left of the screen, through looking at collaborative technical assistance. How do you work with your healthcare system, education, early intervention for children? Perhaps the child welfare system is involved with the families that you're interacting with. How do we disseminate information? If you're not currently on our listserv, we would encourage you to do that so that you can get all of the new resources that come out. There are some free training resources on the National Center's website, training on substance use for child welfare and child welfare for substance use treatment agencies, as well as engaging courts in understanding their role, responsibilities when families are challenged with substance use and mental health conditions that affect their ability to safely parent. One of the specialized programs that we operate is for the regional partnership grants that were created in 2007. There's some 130 sites that we've provided TA to. And then you're going to hear from the director of the in-depth technical assistance program and senior manager about what does that mean and what's available to you. And then over the years, we've conducted a variety of policy academies and are working with the regional offices right now, looking at some of that ongoing work that needs to happen within the states and the regional offices. We use this framework of these areas of practice because we recognize that over the years, better outcomes for families happen when there's early identification in families that need substance use services. There's timely access, that they have access to recovery support services. And we recognize in the evolution of women's substance use treatment that family-centeredness, meaning how she defines her family, how her children are incorporated into those service plans, become really important towards her success. And that there is some way in which we're recognizing right away when a family needs additional supports. Those practice changes have to be sustained through these policy efforts that support the practice innovations over time. So is there a commitment within your collaborative effort, within your agency, to a shared mission, vision, and the goals of the grant program and the larger programs within your agency? Is there efficient cross-system communication? I know we all struggle with that, even with this new era of everything happens electronically. How does that get efficient cross-system communication? The need for ongoing staff development and cross-training with those other partners, the healthcare system, early intervention, all of those other agencies that your families need service from. How do we make sure that we have this ongoing staff development in place? I've mentioned sustainability and institutionalizing these new ways of doing practice already, with a sincere focus on how we measure outcomes and monitor the effectiveness of our work. We think of that shared outcomes for families with a focus on equity as the 5 R's and an E. Recovery, remain at home, reunification, repeat maltreatment, reentry to care for those families that are involved in the child welfare system, and those outcomes that need to be disaggregated by key characteristics, race, ethnicity, gender, and the other key demographics that sometimes affect these 5 R's, if you will, about what we're looking for in terms of measuring recovery if children are staying with their families, all of those R's that we've named that align with the outcome measures of children's services, healthcare, and substance use treatment and recovery services. I'm going to turn things over to Program Director Kimberly Coe, who's going to talk more about the technical assistance that's available to you as a PPW grantee. Kim?
Thank you, Dr. Young. I appreciate being able to talk to you all today about some of the in-depth technical assistance that we offer at the National Center, and specifically the team that I work with, the Family Centered Systems Innovation Team. Since about 2014, the National Center's Family Centered Systems Innovation Team has focused our work on responding to the needs of infants and their families that have been affected by prenatal substance exposure and the recovery of pregnant and parenting people and their families. This includes assistance to states, regions, tribes, agencies around the implementation of the 2016 amendments to CAPTA. And one of the things that we want to make sure that we emphasize today is it's our goal that any of the new policies, protocols, and practices that are developed when we're doing this work are supporting systems and families in the context of their culture and their communities, which means including leaders and stakeholders from across systems and representatives of their communities within their governance structure. So at the National Center, our technical assistance really begins with learning about the agency, state, or region that's requesting technical assistance. And we know that every community and every agency really is unique, and that listening and learning is an important first step in our being able to provide the best technical assistance that we can. I wanted to introduce our team. We don't have time for everyone to jump on camera individually, so I'll just say that the people that you're looking at on your screen right now are change liaisons that do the work directly with sites. They come from diverse backgrounds and experiences. Their professional experience ranges from policy development at state and local levels, experience in working in different systems, including child welfare, substance use disorder treatment, mental health treatment, frontline administration level. So I'm really proud to be a part of this team and the exceptional expertise and experience that they bring to this work. The next slide is more members of our team, including Some Lewis, Aishantola Edwards, and Elise Thomas. These are the people that are really the glue of our team, and they bring their own expertise to our work to help us be successful. Their work is often around research, material development, and responding to technical assistance. If you are receiving technical assistance from our team, you will undoubtedly meet them at some point along the way. I think we mentioned earlier that our approach to technical assistance is really tailored to the unique needs of the agency or the state or the jurisdiction that we're working with. But over our 20 years, I think Nancy said 22 years of experience with the National Center, we have lessons that we have learned through our work across the country and common approaches that we know have been successful. And so through those lessons, we've developed this menu of technical assistance options that we hope help to guide sites or agencies or jurisdictions in understanding the scope of what's available through the development of their own tailored technical assistance. So, for example, the expansion of recovery support services may be about expanding the authentic engagement of people with lived experience. Treatment engagement may be technical assistance that's about the implementation of universal verbal screening for people across system providers or co-location strategies. Anti-stigma campaign. Unfortunately, despite all that we know about substance use disorder, stigma still remains one of the main barriers to people getting the treatment that they need. So the developing anti-stigma campaigns, completing a collaborative values inventory, which we can tell you more about, with stakeholders, developing resources and strategic plans for rolling out an anti-stigma campaign are also examples of technical assistance that sites have found really helpful. I mentioned before the technical assistance specific to the 2016 amendments to CAPTA. And some of our technical assistance is about creating family wellness plans. So moving more upstream and helping families that have been affected by prenatal substance exposure prior to the birth event happening. This includes addressing maternal health as an important part of birth outcomes and using that opportunity to engage with families much earlier in the process. Culturally responsive and gender-specific services, TA around that, it may be centered around ensuring trauma-informed services are offered within the array of services. We also talk a lot about data and data capacity, which is almost always a challenge initially. Some of the technical assistance that we have found successful and that we are able to provide to sites is around helping to identify where data can be found, where some of the data that's needed can be found, establishing data sharing agreements between key partners to make sure that information is being shared, and establishing cross-system indicators that help to make sure that we're all working towards the same end. We talked already a little bit about a family-centered approach. This is a foundational in the technical assistance that we provide. Some of the TA related to that may be about community mapping, what exists within your community, and then strategies for filling the gaps in places where there isn't services available. Really helping to build a collaborative capacity to be able to serve whole families, which includes expanded services for children. Some of the TA around that may be around developing service plans that include screening, assessment, and then being able to put together the service provisions needed for children. Also, a part of a family-centered approach is being able to expand the service array that's available for families. We talk all the time about we can't do this alone. There's no way for one agency, one system to be able to provide the services that families need alone. We need to be able to work together. So this technical assistance around expanding the service array is really about shifting the paradigm from client-focused to family-centered, and the array of services that require collaborative community partnerships to make that happen. And then also related to all of that is then collaborative case management. So making sure that families receive care coordination that builds on that comprehensive array of services, reducing redundancies and maximizing efficiencies, hopefully making it easier for families to navigate through the systems that are in place to help them. And then all of this is delivered. Nancy talked about one of our frameworks. Another framework that is key to the work we're doing is the 5 points of family intervention. This framework describes major points in times where agencies, state systems can improve outcomes for families that have been affected by substance use disorder, and to really effectively serve this population means looking beyond that primary focus that the specific agency may have, looking for opportunities to help along the continuum of that child's life. I'm trying to, that is a very quick snapshot about that framework, and we'd love to talk to you more about any of these things. But I'm going to turn it over to our senior manager, Jill, to talk to us more about governance structure.
Thanks so much. I want to dig in a little bit deeper into what technical assistance looks like and just recognize that some of you have a relationship already with the National Center and with the Change Liaison, and we may be new to some others of you. So those who are new are always welcome to reach out to us to talk to us about how we might support you around any of those technical assistance areas. Whenever we are working with the site, one of the early pieces that we like to tackle is governance structure. We really recommend to sites to think through implementation of a governance structure to oversee the work of the grant and to help with addressing barriers as they come up and to create really a collaborative mission and vision for what that implementation should look like. We like to start with the core team, which is the middle row here. And ideally, the core team is a group of management level stakeholders who would be overseeing whatever this implementation process is. So these are folks who might be able to implement a new policy, to maybe shift funding a little bit. And ideally, it's not just folks from a single agency, but that it is collaborative in nature. So thinking about all the different systems that are going to be touching the families that you're supporting and how do you to help so that they could really help implement a practice that's going to be cohesive within the broader community. Sometimes these core teams spin off work groups. They're kind of ad hoc, as needed teams that really get to the frontline implementation. So they oftentimes meet more frequently, whereas a core team largely meets monthly. Sometimes these work groups might meet weekly because they're really standing up and building up that new practice. And then finally, we like to have folks implement oversight committees. And you can think of the oversight committee as director level. I always think of them as barrier busters. They're the folks that really tackle the thornier issues that might take a longer time than even sometimes the grant is going to be lasting. So I'm thinking of a grantee that I worked with at a county level who was really struggling with a lack of developmentally appropriate services for children. And there was just a lack of funding in general. And that wasn't something they could tackle, but they kept bringing it up to their oversight members who represented county funders and they had some state representation on that team so that they could keep bringing it up in those budgetary meetings to legislators and things like that. So it continued to be an issue that folks had an eye on. So we've seen that when sites implement these types of structures, we've seen more success in terms of what they've been able to complete around their implementation supports. So if you're working with us already, you've likely been assigned a change liaison. And if you're reaching out to us, one of our primary components is really to build a strong relationship with you. We want to, engage with you, assign the right change liaison to you, and to develop that long-term trusting relationship so we can support you no matter what we're tackling with you. And what that support looks like, I always think of us sort of as the engineer driving the train of this big project that you're working on. So we are going to help you with agendaing and scheduling, facilitating meetings. We are, we're not an expert necessarily on your system, but we've seen lots of other systems try to implement similar strategies. So we have a lot of information about, hey, this really worked, or we saw these kinds of barriers that we're constantly bringing to the work. We are always happy to work with you to build out a virtual training, to facilitate a brainstorming session, to help you identify missing folks at the table and think of how to engage them and bring them in. We also do a ton of work with peer-to-peer learning. So we are working with states and have been working with states across the country, from the agency level to the county level. We've been working with tribes and state systems. So if you're working on something, we always say, don't reinvent the wheel. Somebody has probably done something similar to this before. Ask us about it, and we can probably not only get you an example, we can get you into the same virtual room with them to really pick their brain and ask them, how did you get there? And what do we need to know about making the same journey? And then finally, we do a ton of resource dissemination. Dr. Young talked a little bit about this. If you haven't been to our website yet, it is just chock full of all different resources. Anything that you can think of that relates back to parents with substance use disorders and child welfare, you'll find some kind of content related to that on our website. Or if you find it overwhelming, as sometimes people do because there's so much there, you can always reach out to us and say, hey, Jill, I really want something specific to, safety and risk with parents with substance use disorders. Can you kind of curate something for me? And we'll get a sense of what you're looking for and then pull a package together for you that makes sense. Some of you are already working with change liaisons, and so those are our staff members who engage with grantees and have kind of longer term regular relationships with them. I said earlier, I always think of that change liaison as the person who's sort of helping drive the initiative, driving that train forward. So again, we help with scheduling and facilitation of regular calls. We help match you with the right resources or match you with the right peers that you could learn from. We also have a big toolkit internally of different kinds of tools that can help you as you're dealing with your own sort of challenges through implementation. So we might say, oh, you're kind of struggling around mission and vision. It might be helpful to do a collaborative values inventory. So we'll constantly be, providing these sort of different tools and checking in with you to see if that makes sense and help facilitating. And again, we do a little bit of teaching, we do a little bit of coaching, we do a little bit of resource connection. So those CLs play a pretty broad role as they're helping you through the initiative. So I want to talk a little bit about family-centered approach. So we do some work around helping sites move to a more family-centered lens. And I realize this might not be a specific area that you're looking at within the grant proposal that you have currently, but it's something that's always on our radar. And we always like to sort of pitch this to folks to get you thinking about this. You are all working with pregnant and parenting women, which means that you're not working in a silo because that mom has a child and, she probably has a whole other group of family members as well. So we like to think about how do we get past just treating the individual, really to treating the family. And I'm just going to give you a very high overview of this today. We have another couple of webinars in the works, and one of them in February is going to dig much deeper into a family-centered approach if that's something you're interested in, and we hope you'll join us. When we talk about a family-centered approach, we're really defining family however that client in front of us is defining family. So that might be their nuclear family, it might be their extended family, it might be folks in their life that play a significant role. So whoever that is that person's family. And when we talk about family-centered treatment, we're really thinking about this continuum that's been evolving and growing over the years, where we really started in a pretty sort of almost siloed place where we think about a single individual coming into care, where we might ask about the family in terms of the treatment plan or service plan, but really the treatment is focused specifically on that individual's needs. And if we go a step over in terms of being family-centered, we might have a facility that offers childcare, but there's no therapeutic programming. So it's essentially kind of babysitting on site while mom typically is doing her SUD treatment work. The next step is really where I always think of it as sort of parallel play, where mom is getting therapeutic services and the child is getting therapeutic services, but there's not a lot of coordination, right, to bring it into a more of a family-centered model. And if we go the next step, we're seeing that grow and to start to include other family members and maybe some coordination or discussion about what's happening with the family until we get into a family-centered model where not only does each person within the family have their own treatment plan, but there's also a coordination piece that's holding them together. So we're talking to one another not only about progress and challenges within each person's treatment, but how does that then impact more globally the family together. To do this requires an enormous amount of communication and engagement and a collaboration across systems. And this is what we'll get into in that webinar in February. but it's understanding who in your community is doing this work. How can we engage with the healthcare folks who are providing the, OB services for my pregnant mom that I'm supporting? Who's doing early childhood work in the community, and how are the kids of the parents that I'm treating doing in terms of meeting their developmental milestones? What's happening with child welfare, with housing, with the courts? So there's no way that you will have all of this under your roof, but how do you build these partnerships and systems to be able to move that one step closer to family-centered services? So we mentioned a couple of times that we have some webinars coming up that are going to be more content heavy. So the first one is January 16th, and it's going to be looking at the collaborative practice 10-element framework, which is one of our tools, but we'll be talking about really what does it mean to collaborate with your partnerships? What does that look like? What are the tools to help you get there? And then in February is that family-centered approach webinar that will be digging into what does it mean to be family-centered, and again, some strategies to move the needle for your programs if you're interested in going in that direction. So we have some time. If there's folks that have any questions, again, for those who haven't worked with us or aren't engaged in a relationship with us currently, we would love for you to take a look at our website, to reach out with us if you have thoughts or ideas, or kind of are looking for a specific resource that we can support. But let me pause here and see if there's any questions. And I think you have to use the chat or the Q&A box. Not seeing anything?
Oh, Jill, there haven't been any questions put in the Q&A, and it's delightful that folks are telling us where they're from and who's on the webinar, but I didn't see any specific questions in the chat. So not sure. Oh, wait, something popped up in Q&A. What's the process if we don't have a change liaison yet?
So you can reach out directly to us if there's a specific TA need that you have. So if you were thinking about this, as we've been talking, it's like, gosh, it would be really nice to sit down with somebody and think through what's going on with our sort of assessment protocol from child welfare over to us, because we're having some issues with that referral and that communication pathway. We'd always be happy to sit down with you and to kind of work through that. If you were curious when I was talking about risk and safety resources, and we're like, what is that and what does that look like? You can reach out to us and we'll connect you with some of those pieces. If you just want to be like, this was great, but I learn a little better if I can have a one-to-one with one of you and kind of dig through some of that, you could always reach out and do that. And so maybe you can pop some emails in the chat. You can pop in my email and your email, so you can reach out directly to us. And then there's also a general National Center email box that we'll throw in there too. If you're like, I don't want to go directly to you guys, I'm happy to go to the big mailbox. You can always do that too. And then we will triage your request there and get you what you need.
Jill, talk a little bit, or Kim, either of you, about what do we, well, I should have said when I introduced Kim Coate that she operated PPW grants for more years than I know how many she did. But we first met when she was the project director of a PPW grant in Vermont. So, what did you think TA was when you were a grantee? And how would you answer the question now? What is it that we're talking about when we say technical assistance? What can you ask for, and what do you get?
Well, what I can tell you I was a project director on a number of PPWs and also some RPG grants. I wish that I knew.
Let me interrupt you. RPG is?
I'm sorry, regional partnership grants. Also, I think Nancy described at the beginning when she talked about some of the other technical assistance in the projects that we're involved with. And I talk about this a lot, that I wish I knew back then what I know now about what technical assistance could be, because I really didn't understand. I didn't understand what the scope was of what was available, and also what it meant to ask for it. Like, did it mean that we were doing something wrong and needed some sort of corrective action? And really, what it doesn't mean any of that. It means you're trying to improve outcomes for families, and you want help with that. And you can call us if it's about families that have been affected by substance use disorder. You can call us, and we can talk to you about that. It may not always be that we are the right match to be able to help you, but we will always pick up the phone and find the right place for you to go. So there really is no wrong question to ask. We take the expertise that we get is from working with all of you and from listening and learning with you, and then carrying those lessons forward. So there's never a time that we're not interested in having a conversation or to be able to try to solve a problem with you. One of our change liaisons, Sean Couch, who I think is on this call as well, always describes it as we walk beside you on that journey. Like, what is it that what are the outcomes you're looking for, and how do we help you get there? And it really is tailored to what you want and what you need and are asking for. We're excited about this. Is relatively new for us at the National Center to be working to have this relationship with the PPWs. And we're excited that Amy has, through being our ACORE, has made this possible, because the reality is we are all looking for the same thing. We're working, these are the same families. We want the same outcomes. It makes all the sense in the world to me that we're working together to get there.
Thanks, Kim. There's another question. Can you talk about data collection processes and tools in that area of our work? What does technical assistance look like when somebody says, I need some help with our data collection, and how we're doing that?
Mm-hmm. Jill, do you want to take that one?
I can start and you can jump in. Okay. So I think just Kim was talking about how this is really individualized. So some of it's going to be like, what is it that you're specifically looking for, and what can we help you with? One of the tools that's come up with the PPW work that we've started to do recently has been what we call a drop-off analysis. So where we're trying to understand of the total population of families that you're trying to serve, how many are actually making it in the door? How many are getting assessed? How many are making it through treatment? And then and what are the outcomes of, are they reunifying with their children, that kind of thing, whatever the outcome is we're looking for. So in that case, we're working with grantees to start to get that data, which is usually program level data, to get an understanding of sort of the community of folks, and then sort of plugging pieces in from there. But I know there's some state level grantees as well. We've definitely done work at the state level to understand data, but at that sort of bigger level, which usually takes quite a few more steps, like developing maybe a memorandum of understanding to start to help with some of the data sharing, and to understanding what's happening within the child welfare system. How many of the parents are identified as having substance use disorders within child welfare, and then how many of those are making it over to treatment? And then again, what are the outcomes in treatment in terms of, are they assessed? Are they treated? Are they staying engaged in treatment, and are they completing? So there's a very different level of effort to those. But again, just to give you an idea, that when you talk to us about, hey, we want to get a sense of data, we'll work with you to figure out, where are you trying to get to? What's the outcomes you're trying to measure? And then how do we take steps to support you to get there?
Yeah, I like that, Jill. Starting at the end point of what are the outcomes. You all have your requirements to send to SAMHSA about the numbers being served. But what's going to be able to sustain your practice over time is understanding the outcomes that are being achieved for families. So backing up from there, where does that data sit? there are a multitude of assessments that families go under when they're interacting with multiple systems. Who's got that data piece? How do you pull that together so that you can look at all of the assessment tools, data collection tools, and make it make sense? We often talk about like reducing the noise and increasing the communication, because there's so much that happens for families that we try and make it rational about who's collecting what that we need to know. What about, Jill, you talked a little bit about the drop-off analysis, but what are some of those strategies for retention? What have we run into in working with PPW grantees about retaining families in services?
I might take that to Kim because I know she has so much experience with the PPW world herself.
I think that family engagement is a big piece of work that we do with all kinds of grantees. It's certainly, I think, I don't know that we've worked with anyone who hasn't identified this as a challenge along the way. And there's, like everything else, there's multiple things to look at when we're looking at family engagement, including the referral pathways. How are families getting to us? How are they being told about the services, and then what process is happening, what's happening once they get in the doors. And we know that everyone has a bazillion requirements around data, around forms, around assessments, around process. Where is the connection to families that we can strengthen? And that's part of what we can help bring to the table to help you think through. Where's the opportunities to strengthen that engagement? Where we talk a lot about the value of authentic engagement of people with lived expertise. Are we asking people who have received the services, who are actually going through this, what worked for them? What works for you? What seems right about what's happening here? There's a lot of different strategies around that. And again, I think sitting with and walking with people through the process of trying to understand how we keep families engaged is important. But it has to begin with looking at the data. What do we know about who is staying engaged and who isn't? It isn't just about the number of referrals or the number of admissions. It has to be about engagement. And ultimately, it has to be about, do we know if families are doing better because of the services that we've delivered?
It reminds me that last year we had the opportunity to bring together people that work as peer recovery support staff. So people with lived expertise in substance use, and generally they also had expertise specifically in the child welfare system. And overwhelmingly, the thing that made the most impact on me was thinking about engagement in terms of core needs, core supports. I mean, it makes sense. We all know, you have to get Maslow's hierarchy first. So you can have like the best trained therapist or caseworker or someone who's working with that family that has like all of the skills for motivational interviewing, for other kinds of engagement strategies, for therapeutic approaches. But if the family says, that's not my immediate need is I need childcare. I can't get to you. I don't have transportation. I can't do this or that because I've got these basic needs. That really understanding the basic needs, that is the most effective engagement strategy. And hearing that from all of these folks who, had the lived experience to say, this is what I experienced early in treatment and in recovery services, that I really needed the help with those core things. So backing up to say, what is it that the family expresses as their need, and how do we bring that service into play so that we can get to those things about engaging in a therapeutic process or in a therapeutic relationship. So it was a great opportunity, and we look forward for when we're going to get those materials out pretty soon. Is there a specific assessment tool that's used to collect data? I think in the, I'll have other people respond to this also, but I think in the PPW world, there are specific data that are required by the grant. But part of that data collection technical assistance is who's collecting what and what do we need to have. How do you, again, back up from the outcomes you're trying to show over time? How do you bring back into play the different assessments that families may be experiencing? What does your state require? Is your local jurisdiction require something else? Is it something that is already in a data package that's required? And then you either can supplement or, hey, that's everything we can collect, because assessment at the front end of engaging a family is overwhelming, totally overwhelming. So how do you phase that? I think that's some of the experience for sure with the regional partnership grantees. How do you phase the assessment process if you need services from multiple agencies? You need developmental interventions for the 2-year-old. How do you not have that family have to go through telling their story one more time to one more agency? How do you rationalize the assessments, which comes down to oftentimes how do you share information and reduce the noise between agencies so that that information can be shared and they don't have to tell their story over and over and over again. Is there a specific tool? I mean, I know that I think all states at this point in their systems have standardized assessments that are required in their data system. So helping you figure that out, and is that assessment that's required in your particular state meaningful to your agency? Or is there a way that you can get what's required by both the federal government, because you're a grantee, usually your state government, and then what's really of utility to families? And that's some of that work that we have to pull apart and say, where does that variable sit? Who's already collecting that variable? How do we make this a rational data collection plan that gets us where the information that we need and doesn't repeat the same assessment process over and over for families? Others that want to chime into the chat or the Q&A box about what are there specific assessment tools that you're using? We certainly recognize those for standard assessments for substance use treatment. There are also standard assessments for how children are doing, the basic needs, recovery capital, all of those kinds of things that we're interested in to understand how to really meet the needs as the family has defined their needs. But others that might be willing to kind of put into the chat, what are you using?
When I think about this question too, Nancy, I think about again how individualized this is, because it really depends on what data, what jurisdiction, and how you get it is so different from place to place. And that I will say is one of the places that I think, again, technical assistance is really valuable in helping to navigate that and to figure that out. I wish there was one tool, there was one way, but there isn't. And maybe that's a good thing, because families are dynamic and they need us to respond differently and uniquely. But as we've said a number of times, there are many resources around data collection on our website that are available to you. And technical assistance is really about helping you map that out.
We have an older document that's still relative called SAFER, Screening Assessment for Family Engagement and Retention. And it in the back has many screening and assessment tools and the psychometrics that are around that, what's been published on those tools, how do you use it, information that's in an appendix about screening and assessment tools. But it comes back to really laying out at the beginning of the whole monograph about how do you form the partnership that's needed between the various agencies that families are getting services from. So someone reminded me recently about, SAFER's still relevant. even though it's one of the earlier monographs back in the days when we actually printed monographs and had it in hard copy. Now you can locate it on our website. But I was told by our office manager recently that we have more safer hard copies that are available. So it's an oldie but goodie in terms of what are standard screening and assessment tools that are used in substance use treatment and recovery agencies.
Nancy, one other thing I just wanted to make sure, I know we're coming toward the end of our time. I wanted to just acknowledge that the expertise that we talked about on our team and with our staff is so important, because we understand the level of responsibility that you all face in trying to do the work that you're doing in your wherever you are around the country, and the urgency that families have for us to get this to do this and to figure this out. We don't have the luxury of just taking our time to figure it out. People need us and need this service now. So we understand the pressure that you're under and the barriers. And I think the importance of the relationship with the National Center, with the Change Liaison, it's an important part of that piece of being able to get the shared outcomes that we're all looking for.